name is Rayyan. I am a third-year biology major here at UCR, and my postgraduate plans are to go to medical school.
My name's Alyssa. I'm a fourth-year neuroscience major. I'm also a transfer student, and my plans are to apply to medical school next year as well. What are the HPAC ambassadors, and what role do they play at HPAC?
Sure. So I think one of the most important things about being an ambassador is not being someone who tells a student what to do, but being someone who guides that student in the direction of their interests. So when you come into our office, we aren't going to be telling you what you should do, but we'll listen to what interests you have, and we're going to guide you in the right direction. So a lot of times when students come in and they're interested in shadowing opportunities or in internship opportunities, we can guide you and connect you to the resources to move in that direction so that you can get those different opportunities.
HPAC ambassadors have been there and done, right?
Yeah.
We've been through the hardships. We've been through, how do I talk to a professor? How do I put myself out there? How do I study? Even those simple questions on how to get my foot in the door with these things, not always about opportunities and it's also about, who are you as a student? Are things working for you? And I think we're able to give that validation and that real peer mentorship to these students. All right, Rayyan, I have a question for you. What made you want to become an HPAC ambassador?
Sure. So one of the main reasons I actually became an HPAC ambassador is because I saw a lot of value coming into UCR with the ambassadors and how they're able to support students. When I came in my first year, I actually had 2 ambassadors help me, and the support they provided me was monumental in my success in the years following after that. So as an HPAC ambassador now, I really want to be able to be that support for incoming first years, transfer students, and other pre-med students who are looking into different opportunities on campus.
How do you go about meeting with and advising these first-year students, especially when they're so eager to get their hands on these opportunities?
Sure. So coming in as a first year can be very scary, especially if you're a first-gen student. You might not know what to really expect coming into college, and being able to meet with an advisor who can talk to you and kind of get you settled can be a really, really important thing. And what's really nice is when you're going to come in, we're going to see you and kind of talk to you about how you were doing in high school and previously, and kind of see where you're at so we can work with you to kind of build on those steps one at a time.
It's nice to kind of explore what they're interested in with them, just so that they know they have a support system and validate and bounce more ideas off. I like that a lot. So what's something that every new incoming UCR student should know about the HPAC Advising Center and our ambassadors? What should they know?
Sure. So I think one really important thing and one very unique thing that HPAC has to offer is that they actually support different health professions. So if you're pre-med, pre-nursing, pre-dental, whatever it may be, you can actually come in and speak with an ambassador who is on a similar track to you, and that ambassador can actually support you on those tasks depending on kind of what they've experienced here on campus as well, and set you up in the right direction to find the opportunities that you can benefit from. So Alyssa, what kind of questions can students ask you during Ask an Ambassador hours?
Yeah, well, what's lovely is because we're fellow peers and students who have gone through some of the same experiences, I think we can provide just a lot of validating answers to their questions. Sometimes students come in and they want to know, am I doing the right thing? Am I doing it enough? And we can sit there and say, absolutely, what you can handle is what is enough for you. But also we can just help them explore opportunities on campus, off campus, paid, not paid, volunteer, everything like that. So I think we really are here to support them as a student, but also as a peer.
So how would you go about guiding first-year students and transfer students towards opportunities that align with their interests?
Yeah, so I would want to start with what are those interests? A lot of students, they come and they aren't actually sure And I love to do kind of the elimination method with students. A lot of people know what they want to do, but they don't know what they don't want to do. And so I ask those questions with them. And I also want to emphasize education and academics first as a first year and just acclimating yourself to the campus. But I also am not afraid to recommend resources and other ambassadors and our advisors when those certain questions about certain orgs and clubs and whatnot come up.
If I'm a first year student coming into the HPAC office, how would you go about getting me scheduled with an appointment?
Oh, absolutely. Yeah. So we do have advisors, and we're actually very accessible. We have both in-person and online accessibility. So you can either email HPAC or you can come into our office and meet with our front desk, and you can schedule yourself an appointment with an advisor. They'll have you fill out some information, calculate your science GPA, which they help you with. But yeah, it's actually that simple. And then you show up for your appointment and you get all of your questions answered.
If you're interested in coming to an Ask an Ambassador session, we do both in-person and virtual office hours. So you can find all of these appointments on our Instagram at hpac.ucr. So Alyssa, tell me, what got you interested in the medical field?
Yeah, so I actually have two little sisters. And so growing up, I got to be a big part of their life. And one of them actually was diagnosed with epilepsy. And it really just sparked my interest. Like a lot of people, a lot of students, they just have some kind of family or friend connection, kind of experiencing or seeing medicine. And it really just got me interested in the brain. And here I am studying neuroscience. And since being at UCR, I've gotten involved in research related to neuro and, being a caregiver, which is near and dear to my heart. So I think I just found myself kind of doing exactly what it is I was made to do when I was so young. And that's just kind of how I explored it here.
When it comes to medicine, I feel like it took me a period of time where I started learning about medicine and the field itself. When I was in high school, I had the opportunity to volunteer at a hospital. And during that time, I was doing small tasks like helping patients get to their rooms or wheeling them out. And the smiles on their faces, it made my day. And such a small task, having that rewarding of an impact, was amazing. And it just warmed my heart. And I knew that I wanted to go into a field where I was able to really make a difference in someone's life. And going into college now, volunteering at free clinics and working with all these individuals that I care so much for and seeing them improve over time has just meant so much to me. And it's so amazing being able to see someone come in with like a challenge or something that they're struggling with and being able to hold their hand and help them through that challenge and get to a better place where they're truly happy with themselves. So that's one of the main reasons I want to go into medicine.
It's beautiful.